So this is a novel theory of cerebral laterality in psychopathology, and I think it has relevance to your work. Um, um, so the way I came across this was that I was observing two different personalities in patients. That there was, when they came in, they were very symptomatic and immature. They got better, and they were like very normal, healthy, mature people. And then they'd regress and they'd revert back to this other personality that was immature and troubled. And then I was rereading the split brain studies, and it seemed like there was a connection with the split brain studies, which very clearly show that when you cut the corpus callosum for people with epilepsy, you get two independent minds. And so dual brain psychology has a lot of research. I've been studying this for 35 years at Harvard. And the idea is that trauma gets located more in one brain hemisphere than the other, and it can be the left or the right side. And we think that the side that the trauma gets located in has to do with the age of development when the trauma occurred and the type of trauma. But we're not sure about that. But it does seem that in that most individuals, the trauma is located on one side, and it's easy to stimulate, and I'll talk about that. And the other side, is quite healthy, and this leads to clinical applications where you want to treat the troubled side and use the healthy side as a co-therapist to help treat it. So this is a whole paradigm shift from the usual psychiatry that's going on today, with a focus on pills and a DBT or cognitive behavior therapy. That we try and dig into the trauma that is causing the problem. And so we've used in our studies over the years a lot of sophisticated neuroscience techniques. We've had a lot of clinical trials. Right now, we're studying fentanyl addiction, and we have a $2.5 million grant from NIH with a FDA breakthrough designation, and half of it's being done at McLean Hospital, and half at a startup that I have. And what I can tell you, we were still blinded, but about half the people, so half the people are getting sham and half are getting active, and about half the people aren't doing very well coming off of fentanyl. And these are people who've had multiple overdoses and living, a number of them are living on the street. And so it's a real hardcore group. But in that group, we have many successful, I would say at my site, about a third of the patients are doing quite well. And then a number of people are dropping out or not doing well. And McLean is finding the same sort of results. And we will have become unblinded in the fall. Our site is completing the study in about 2 weeks. The clinical applications that I'll describe are used in clinical practices, and dual brain psychology is the first psychological theory and application to come out of rigorous research, namely the split brain studies, which won the Nobel Prize, and to be supported by 35 years of research, mostly at Harvard. So these are the split brain experimenters, Roger Sperry in the middle, Joe Bogan and Rand Zeidel, who worked with him. And the idea with the split brain studies is that the corpus callosum is, can you see my cursor?
Yep.
Okay, so this gets cut to try to treat intractable epilepsy. And as a result, if you show something to the lateral visual field, in this case, it's the left lateral visual field, goes through the lens of the eye, hits the medial retina, and crosses over to this side here, and only the right brain can see the image. You ask the right brain, the left brain, which can speak, only the left brain has speech, and he has no idea what was shown, and can't pick the item out of a box with several items in it. The right brain, however, with its left hand, which is connected to the right brain, can very easily pick out the item. So Roger Sperry showed a picture to the left lateral visual field, and it was only seen by the right brain. And the left brain, she started giggling, and they asked the woman why she was laughing, and she had no idea. She confabulated, and but we know why she was laughing. She saw a Playboy nude presented by distinguished Roger Sperry, and she thought that was a cause to giggle. The right brain has political opinions. You could show a picture of different political figures, like Hitler got a thumbs down, and one guy could express himself with Scrabble chips, and he said he wanted to be a draftsman in his left brain, and his right brain wanted to be a race car driver. And after the operation, the two hemispheres have very different aspirations and attitudes. And one person wanted to smoke, and his other hand, controlled by the other hemisphere, kept putting the cigarettes out. One woman wanted to put on a dress, and her other hand kept unbuttoning it and trying to take it off. And so this is a setup that Sperry used. He'd put a word on each side of a computer screen, and it would only be seen by the opposite brain. And so the left brain could speak, and it would say, it saw the word brush over here, and it would say brush, and the right brain could reach behind the screen and pick out the item amongst several items. So I did a study with Bogan and Zeidel. Sperry had died about 2 years earlier. And this was I think it was the last split brain study done in California. And it was the first one to do a psychological inventory of the two hemispheres. And so I asked, how much do you feel? And two words would come up on the computer screen. One would be positive. There were positive words and negative words. So, and each hemisphere got all of the words. And we had graduate students look at pegs where the hands would point to a peg. There are only 4 here, but there were 5 answers. It was from none to extreme. And we got very reliable answers. And in one patient, he seemed to be had a higher opinion of himself in his right hemisphere. And his positive words, he scored somewhere between quite a bit and extreme, whereas his left hemisphere scored an average of moderate. And the other patient scored similarly on both sides, but he told me with his speaking left brain that he'd been bullied as a child. And I know that bullying is a serious trauma. And so I asked him, I injected some questions about his being bullied while I was testing him, and his right hand signing for his speaking left brain confirmed that he was not upset by the bullies. He said none, 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 and but his right brain signing with his left hand. Remember, in all the other questions, they were similar. Here it was different, and the right brain was extremely upset by the bullying, even though the left brain was not. And so this is a picture of Werner Wittling, and he's a German scientist who made this elaborate device purporting to show movies to one hemisphere or the other in normal people. So people who didn't have surgery. And it was, I had to read the protocol several times, so I figured out what he was doing. And essentially, he was showing the movie using eye tracking and masking a computer screen to one lateral visual field or the other. And I figured that on my budget, I could do the same thing. So I tried this and I didn't respond. I did a few years later, and I still do to this simple technique. And I'll show you an fMRI study that supports it. And I asked my first patient that day, and he was a Vietnam veteran who had PTSD, was doing well, and he got very upset. And he said, "That plant behind you looks like the jungle." And I said, "Really?" I said, "Try the other side," very quickly. And he said, "Oh, it's a nice looking plant." And I see this kind of response in about 55% of patients. About another 30% have at least a 2-point response, 2, 3, 4-point response. And about 15% of patients don't respond. Often they do later. So this is an fMRI study where we put people in the scanner with taped goggles. So if they looked one way, they could only see out the left lateral visual field or the right lateral visual field. And what we see is that blood flow increased in the contralateral hemisphere. And so that this simple intervention of looking out one lateral visual field actually has a profound effect, and that people feel differently, and they'll see me either critically or empathically, depending on which side they're looking at. Their worldview changes, and the view they have out one side is of a child through their traumatized lens. And then this is a more modern version of our glasses where you can flip them and look out the other side. And in therapy sessions, I have people look out one side and then the other, and we go back and forth. And I talk to two people and one person. And so this is a sort of a diagram of the theory of dual brain psychology, that one side is healthy, and it could be the right brain that's healthy, or it could be the left brain. And the other side could be like this tough guy over here. And often people come in and they don't know that they have a healthy side. And we demonstrate it for the first time. And that the two sides are like two different people, and they can fight and sabotage each other. They can compete and or cooperate. And so what I call dual brain psychotherapy is to try to treat the troubled side. This is a guy. I want to. So it's about 2 minutes.
Right, you're right on.
Can you hear that all right?
Yep, I can hear.
So, how much would you pay to go to my casino in the back?
So he's a gambling issue.
600. 700.
I had a picture of an angry man on the screen.
Yeah, now I'm not hearing anything anymore now.
What about 1100? I'm sure. Screwed that up. So when I had him look out the other side, he wouldn't pay me anything to go to my casino. So we'll go to the next. I'm sorry. Um, so I got him up to $2,000 on one side. Let's turn up the volume here. Yep. Okay, we'll just go to the next slide. Okay, so then another guy, after I made this discovery with my hands, I made tape goggles like we saw in the scanner. And I had a guy who I treated come back and try them. And he did very well. He had a cocaine addiction. And it turned out that his father was always demeaning towards him. And so he put the glasses on, he looks out one side and he says, I don't know, I was never comfortable around my father. With these glasses on, it's sort of like dealing with him again, because it's always the unknown, and it's always a pressure and a problem. Yeah, you feel the unknown, you have the tension. Then he looks out the other side. All he's doing is he's just looking from one side to the other, and it happens in seconds. I can deal with him on this side. I know how to handle him now, and I don't think he'd get me upset. And I wouldn't do the counterproductive things if I looked at him out this side all the time. I feel more pity for him and for the relationship. And I don't think I'd want to abuse myself by using drugs. And then this is a study where we did an fMRI study, and we found that people who had a left positive hemisphere had a large reward center, nucleus accumbens, a small fear center, amygdala, and a larger hippocampus on the left than the right side, and the reverse on people who had right hemisphere positive. And so this is just a diagram it's not to scale. But I want to show too that there are two hippocampus. There's a left hippocampus and a right hippocampus, a left amygdala, and all of the parts in the hemisphere are bilateral. And a lot of times people think just speak about the amygdala or the nucleus accumbens, and most researchers don't look at the lateral differences. And then this is a DTI study. It follows the tracks, and there are differences between left lateral, left positive and right positive. And then we did a study with people who got TMS for depression. They got a 2-week course of TMS, and we put the goggles on as a baseline, asked them to look to the left side and the right side and measure their depression. And those who felt more depressed looking to the right means that their left brain was negative. And TMS, for some unknown reason, is always treated on the left side. So we predicted that people with a negative left hemisphere would do poorly. And that's what this shows here. These are people who had a baseline that indicated a negative left hemisphere. And there was only one woman who did well. She was left-handed. And the rest, this is a very poor outcome. And all the people who had a good outcome were predicted to do well. And over here it shows that people who were predicted to do well had a 40% improvement in their depression 2 weeks after their 2-week treatment of TMS. And people we predicted to not do well had an 11% decrease in depression. That was highly significant. So I wanted another way to stimulate the positive hemisphere. And so I thought of using near-infrared light, and I worked with Michael Hamlin at the Wellman Center at MGH, and we did the first treatment using transcranial photobiomodulation, which is using near-infrared light through the skull, goes into the brain, and we've had no adverse reactions. I've been doing it for 15 years at all, and so we've had a number of studies using this, and turns out it's about 2 to 3 times stronger generally. And so this is a guy who came in and he wanted a drink. He measured it 7 of 10, and he'd pay me $500 for a beer. And after a 4-minute treatment, he didn't want to pay me anything, and I offered it to him for free, and he wouldn't accept it, and we both laughed. This is a guy who had been abused by a violent father, and I showed him a picture of this angry man that we use, and his leg was bouncing up and down about an inch per second, and I treated him, and he stopped shaking. His leg was still, and I just said to him, I said, "You're not shaking now." He said, "No." And he measured his decrease in anxiety as extreme. And this was an NIH study that we did. It was a phase 1 study with 40 subjects. Half were done at McLean and half at a startup that I have. And we use unilateral transcranial magnetic stimulation. We use the goggles to see which side to stimulate. And we put the light over the positive hemisphere, and they don't get any therapy other than this. And so the placebo group, which was half the group, went down 1.5 on a 10-point scale of cravings. The active group went down 4.5 points. And that's the difference between using and not using. And the effect size was 1.5. The high effect size is 0.8. So it's sort of twice high. And we also had a decrease in use that was significant. And this is another clinical trial done earlier, and we looked at depression, and these were not severely depressed people. This is their Hamilton score. It was just on the cusp of depression, but they went down from 15 to 8. And also on anxiety went down to this is 8.8. This is 8, and this was with one treatment. They either got a sham or an active treatment. It was a within subject trial. So now we have a new model device. One side pulses at 1 hertz to inhibit the negative hemisphere, and the other side is continuous to stimulate the positive hemisphere. And we're getting remarkable results with this. I'm running a study on depression now, and the study isn't completed, but the results I'm not blinded here. This got right now it's getting a 65% drop in depression right after the treatment. So dual brain psychotherapy is where I talk to 2 people and 1 individual. Somebody walking by might think we're crazy, and I teach the patient how to talk to his troubled personality, and so it's a whole personality on that side. So this is my first book, and I just want to point out Joe Bogan wrote, and he was the neurosurgeon for the split brain studies. Wonderfully readable and well informed. This is the best book ever on the social and psychiatric implications of the split brain research. I'm proud of that. And this is a new book that I have that's more for the public. And I just want to show that I've got a lot of papers, and you can go on my website if you want to see it more. So this is where I want to just talk, and then we can discuss. These are just some ideas about that Michael might be interested in. So in terms of agency, I think an organism or an object must have knowledge and make decisions and learn. But then I ask, does an agent have to have a subjective experience? And to me, that's an important question. And I think that human experience comes out of brain information. I think the brain is an information processor, and the two hemispheres have different information. And the more terrible the trauma, the more salience it has, and the harder it is to get through to the person that the trauma might not recur. So the liver functions intelligently, but I don't think it has a subjective agency, maybe a proto-agency. And the brain within each hemisphere has multiple areas that interact as a collective intelligence. So the amygdala and the nucleus accumbens and the hippocampus and the thousands of other areas within a hemisphere act together. And it's a collective intelligence. And the two hemispheres work together, either destructively or constructively as a collective intelligence. General problem solvers need an obstacle to solve, and life seems to confer a desire to survive, and that can be overcome at times. But when pain becomes, when life becomes too painful, but generally, every living thing wants to survive and strives for that. I think that that's a very important drive, and I think that life has a force that it has information and knowledge, and I think it's a force that's needs to be brought into physics more. It's left out of physics because it's not mechanical. And some solutions of general problem solvers are intelligent, and others are foolish. So all the solutions that problem solvers come up with aren't progressive or helpful. And that's why we get into, particularly in human life, that humans are often very destructive. Another thing I just wanted to mention here that might be of interest is that why do we degenerate with age? And there's development, regeneration, and then there's degeneration, which I think is an important issue that needs to be addressed. So both, let's see, so information must be understood by the agent. So learning and memory of required knowledge is often destructive in people. So we've been thinking that learning and memory is a good thing, and often it is good. But it often, particularly with trauma, is destructive. But not just with trauma. It's the human being has often done things that I mentioned here, that there's a collective intelligence in society. There are groups of people, and we select groups, and the groups have boundaries that can move, and And so it starts with the two minds, and it's our first group, and then it's our family and our neighbors, and then maybe people of a similar political persuasion. We often see the outside group as unworthy or threatening, and different groups often become hostile. And human history, including the present, is filled with atrocities towards each other. And cancer and healthy tissues both fight for survival. That cancer wants to live as well as normal tissues. And some potential experiments, maybe using photobiomodulation as well as electromagnetic fields or chemical ways to influence regeneration and then I'm interested in xenobots and anthrobots and I wonder if they could be used to see what happens when there's a transformation between life and death, and whether there might be a sensitive photon detector that there might be some experiments that might be interesting to study the nature of life. That's what I have to show now. Come off here.
Thanks. Yeah, that's great. I have a couple of questions. Maybe I don't know if I've understood this correctly, but so since you said clinically you interact with both personalities, yeah, the mature one and the troubled one. Does that mean that, and you're also saying that they map onto the two hemispheres? Does that mean that both hemispheres can speak? Because I thought only one of them should have spoken language.
1 second here. There we go. Okay. So I didn't hear that. Can you repeat that?
Okay. If I understood correctly, you're saying that clinically you can talk to both personalities, right?
That's right.
Okay.
You can.
And you locate them in the two hemispheres.
That's right.
Okay, and so the implication is that they both can speak. Is that I thought typically only under the standard case only one hemisphere can talk.
Right. Well, that's an interesting thing. So someone's stimulating their right hemisphere by looking out the left lateral visual field. They can move both arms. They can speak, so what I conceive of is that this is sort of a meta cognition, or in other words, we're talking about a personality difference. It's not a split brain where a person can't move the other side of their body with one brain. So they have access to all of the instruments in the two brains, but the personality and the mind, that each hemisphere has a separate mind.
Okay, and so it's sort of regardless of which one is speaking, they're using typically the left hemisphere's language center to talk, something like that.
Yeah, right.
I see. And okay, and if you were to, what predictions does it have, for example, when they do the sodium pentothal to put one of the hemispheres to sleep for I think it's 20 minutes?
Yeah, well, actually that's very interesting, and in my book I cite that that actually most of the time they don't really see an emotional difference, but when they do, it's usually the person feels better when one side is put down, and it can be either the left or right side, and sometimes the person will get very upset and cry, and so there can be emotional differences, and it can be either the left brain or the right brain that is more negative, is crying or is happy, but with the WADA test or sodium mannitol test.
I see. And yeah, got it. And in patients that either, I mean, there are rare patients that only have one hemisphere, or sometimes people do a hemispherectomy.
Right.
What are the implications then for this kind of thing?
Uh, well, I've never seen such a patient, but in the literature, sometimes there's a personality change. I don't know. They don't really discuss clearly the direction of the change. But the thing that is most impressive is that they're human beings. So you can be a human being who can appear as a normal human being with one hemisphere.
Mm-hmm. Yeah. Yeah. I mean, I agree. I think that's remarkable. We reviewed a number of cases, and I'm sure you've heard of them, but I wonder what you think, where you've got these rare patients who have drastically reduced brain volume in both hemispheres, but yet they have normal or even above normal cognitive performance.
Right, right. Although I think that in animals, the larger the brain, usually the more intelligent, except that in some animals like parrots or octopus, they have more functioning than you'd expect
Yeah.
from the small sized brain.
Yeah, right. No, typically there certainly seems to be a relationship, of course, but you've got these occasional,
Right,
sort of exceptional cases that say that it's not actually required.
right.
Yeah, and what do you think about evolutionarily this phenomenon you describe of the two personalities in the two hemispheres? What is the, sort of in hominid ancestry and so on, where does this come from? When do you think it first becomes noticeable?
I don't know. I think that in development, I think the healthy hemisphere seems to develop more later. And um, uh, and it might be that it's to rescue the person, but it often doesn't get expressed. But when a negative hemisphere, if a child, for example, has a mother who says you're a loser and you'll never amount to anything, and that's a trauma, and then he goes to school and then he can't learn because he's going to school with a trauma, and then the teacher yells at him because he didn't do his homework, and then he becomes truant, and he gets in with a bad group of kids, and then he gets into drugs or alcohol, and drops out of college, and all these things are cumulative and humiliating, and he may never know till he comes into my office that he has an intelligent side to him that is less impaired. And if I give him a light treatment, he feels really good for the first time. These are really exciting things that we're seeing. But I don't, some people have said, well, maybe two minds are better than one, and I don't know. But all animals, even flies, have a duality in their hemispheres, and it might be just to have a duplication in case one fails. And I don't know, but why trauma would get located in one hemisphere, I'm not sure. And the other thing that I don't have an explanation for is that when the eye blocking occurs, just like this, it happens in seconds. That I'll have them look at a picture, and the guy looks more scary, and it looks out the other side, and he doesn't look threatening, or sometimes a person will look at me out one side, and I'll look critical like their mother was, and out the other side I look like an empathic therapist, and so it really is like, it's not just that their anxiety is more on one side or it's just one dimension, but it's really a whole view of the world, and the view of the world out the negative side is the view of a child who's been traumatized. And
Mm, mm. Yeah, very interesting. And what do you think is the situation in clinical cases where they seem to be much more than two personalities? What's happening
well,
there?
when I published my first book, I became friendly with a psychologist from New Jersey, and he had a practice filled with patients with dissociative identity disorder, which is what they're now called multiple personalities. And what he found was that when he used my goggles, that all of the immature personalities were on one side, and all of the mature personalities were on the other side. And the same thing happened with Richard Schwartz, who developed what's called internal family systems. It's a very popular therapy that's used. And his theory is that in the mind, you have a whole family of different personalities, and he talks to them. And when he tried my goggles, his patients felt better on one side and worse on the other. So I don't have much experience with multiple personalities. I had one patient, and she was just too difficult for me to treat. She had profound trauma, and she couldn't relate to me well. And she found another therapist in New Hampshire, and I was very glad that she got some help. These are people who are severely traumatized, but I do think that that the younger personalities seem to be lateralized.
Yeah.
And one of the things that's most interesting to me is the way the two sides fight each other, and a lot of times someone will go well, and the immature side gets upset and fights back and says, you want me to go out on disability? The hell with you, and so sometimes getting well becomes a problem that we have to deal with. So you have some surprise reactions. It's not all that if a person's doing well, it's all good and they continue to do well.
Yeah.
But in the end, most patients do very well.
And so, okay, and so I'm wondering about that. What's the best case scenario in the case of someone who is, as good as a human is going to get? What is the situation there? What's happening with the two personalities there?
Well, I can talk with my experience. I had trauma as a child, and when I was in college, it reared up, and I had a lot of therapy and deal with it. And sometimes in the middle of the night, Freddie will wake me up, and I have to go down and talk to him. And what I do in my psychotherapy is we talk in sort of a Socratic way to the troubled mind, and was it actually your fault? And are you an alcoholic? And is that how you're defined? Sort of as and you can never be well, or do you have trauma that alcohol became a solution for? And if we treat the trauma, will the alcohol problem get resolved? And so there are different perspectives. I don't know if I answered your question. I got lost there.
Yeah, well, I'm thinking. I always with these things, I always try to think about what what's the most hehealthy case possible? So what does it look like when somebody has not
Okay,
had
yeah,
any
right.
uncovered trauma?
I think with me, I think Freddie helps me, and he works with me, but he's still a little boy, and uh, and and I think he helps me as a therapist. You know, I can empathize better, and so we work together, and we're good friends, and so I think that that's the best outcome. I think there are people. I've never had a neurologist put the goggles on and have a reaction. And I think that maybe their two hemispheres are, perfect, or maybe they're repressed. I don't know why that is. But it's interesting. When I do podcasts, I always ask the podcaster to try it. You can just get like a letter or a credit card and do it, and they always respond, and it becomes an interesting part of the discussion. So these are people who are functioning, but they're still carrying with them a side that's got trauma, and I think it's just that the healthier side it leads most of the time.
Do you think it's possible, but just broadly speaking, does anybody become an adult? Obviously, it's a spectrum. Some trauma is horrific and some is less so. But does anybody become an adult without trauma? Is it avoidable? Is there
Sure.
such a thing as a background, as a upbringing that doesn't include it?
I think that is, and that may be a deficit in a way. In other words, it may be that there are people who um, um, don't lack a certain depth because they haven't experienced adversity. And in our lab at McLean, Dr. Teicher has talked about inoculation from trauma, but clearly there are people who are not suffering trauma. But trauma also is pretty ubiquitous. And the way I define trauma is very broad. I think it's whatever hurts you. And so it might be, I think that I harmed my daughter, who's very successful and doing well. And she's a good marriage and grandchildren. But I think that we'd be playing dolls, and then I'd have to go to work. And I think my working so much was a trauma, and we had to work that out. And we have a great relationship now. But when she was in high school, there was she was very rebellious towards me, and I think was expressing some of her pain. So it wasn't that I was my intention was not to traumatize her, but I also had a career that I was invested in, and I think trauma can be disguised, and often a patient will come in and they have no idea that they suffered some trauma, and the kind of trauma that they suffered usually was something that can be recognized as trauma, but sometimes it's just maybe a sibling was more successful, or a parent was ill, and so these can be traumas that aren't recognized ordinarily as trauma. That combat is, or blood and guts, or are obvious traumas, and I see that as well. I see both.
Do you think that is there any kind of a possible world? So let's say, if people didn't need to go to work and they could, that kind of thing, right? If you remove all of those kind of contingent requirements, is there any sort of upbringing that results in an adult that has basically zero of that and does not need any sort of therapeutic intervention at all? Or do you think that's an impossibility just based on living in a community and having other people who don't do everything you want them to do and things like that? Is there any such thing as an adult who doesn't need I don't know, therapy, psychoanalysis, whatever it is? Is it even possible?
Probably not, because and if we look around, there's so much there's so many atrocities that the human being commits, and we see that even today. Or this poor woman who from Tufts was taken by unmarked ICE agents, and that the human being isn't right generally. There's just a lot of hostility that occurs between people, and whether it's just limited resources that causes these fights, or whether there's something about the need for acquiring more wealth and prestige that causes the aggression. But human history is rife with humans killing other human beings.
Yeah.
And also, we're also rife with about half the people in a survey that was done recently suffer a mental disorder during their lifetime. That's half the people in the globe.
Sorry, say it again. Suffer a what kind of disorder?
Well, it wasn't clear. It just said a mental disorder.
Oh, mental disorder.
And most of those last a lifetime, or a lot of them. And so there's a lot of mental suffering that goes on aside from human aggression, just within the aggression within the person. A lot of suicidal behavior has to do with one side trying to kill the other side, and so the conflicts within a person are often cause severe pain, and of course different groups of people competing with each other and having hostility towards each other causes great pain. So the human being has done some wonderful and beautiful things, and it's also done a lot of foolish things and destructive things.
Yeah. Okay. Yeah. Very interesting.
And one thing I should note, in our right now we're studying fentanyl addiction, and we're studying 130 participants, half of which get active and half get sham, and they only get the light treatment. And right now we're still blinded, but a large number of these individuals are coming off of fentanyl. Get a little water here. And so they're coming off of fentanyl, and their lives are doing well. They're feeling better, and all we're doing is stimulating, or what we believe we're doing is stimulating their healthier hemisphere, and we determine which is the healthier hemisphere by this visual technique, and so it may be that the sham treatment is getting the better results, but we don't believe that at this point. But we think that, and in our phase 1 study, I showed the results there, that the statistics were off the chart, and that the cravings and use went down, in the people who got the active treatment, not the sham. And I'm doing a study right now with a new device for depression, and the results with that are amazing. So this is just stimulating the positive hemisphere. Now that doesn't last. In other words, the light treatment will last about 3 days, and that can vary. It can be a little longer in some people and less in others. But it seems to be stronger, but does the same thing as the visual technique. And it's a 4-minute light treatment that we're using in our fentanyl study, and to have someone who has had multiple overdoses come in, and they might be homeless and come off of fentanyl. It's pretty amazing.
And what determines the the length of like why is it that number of minutes versus something else? Like how did you settle on the number of minutes?
Well, I think it might be too conservative. What we were excuse me, we were concerned that we didn't want to do harm. So we were reasoning that if we didn't hurt the skin, we wouldn't hurt the brain, because the light decreases exponentially as it goes into the brain. So about 6% of the intensity of the light reaches the brain. So if you're not hurting the skin, you're probably not going to hurt the brain. And we haven't seen any adverse reactions. We've had a couple of cases of the flu, but we don't think they're related to. We had to write them up, as adverse reactions. But we haven't seen any that we think were related to the device, and I haven't seen any in my practice where I use it under IRB supervision. Mm-hmm. And so what we wanted to do was to make sure we didn't harm the skin, and they're very conservative standards for using light on the skin, and we followed those standards. But compared to other researchers in the field, we're using a higher dose of light than others. But we think it's very conservative, and we probably could be giving a longer treatment than we are. But we'd have to study that. So right now, the FDA has determined that our device and procedure has no significant risk.
Yeah.